Hi, thank you for joining me. Dr. Erica here, pharmacist for 12 years now, since October, licensed registered. Please like, share, and subscribe to this channel. Again, I'm Dr. Erica Onagbola, PharmD. My main channel is Erica OnagbolaPharmd. This is my second channel. Please like, share, and also subscribe. It's the last day of November, and I just want to encourage everyone, stay encouraged. Um, we're entering into a season of a lot of things to get into, and we're coming out of Thanksgiving, and like I said in my previous videos, it's always good to be thankful, to be grateful, for what we have, family, friends, loved ones, to recognize the change in season as well. And well, just to give some more information, this season, November 2025, the last day, I was actually enjoying my family, enjoying news updates, and I did come across TMZ Live, which is a American-based news broadcast, and they were talking about alpha gal syndrome, or AGS. And I was like, wait a minute, did they just say alpha gal syndrome? Because as pharmacists, although we are the pharmaceutical experts in medication therapy, we also are trained to recognize the prognosis, diagnosis, um, the overall, information about research pertaining to disease states, so that we can help to prescribe and also help determine preventative and treatment therapy. So when I heard Alpha-Gal syndrome, I thought about my continuing education, which is a requirement for pharmacists. And part of that requirement is to be trained so many hours per year for renewal of our actual certification. So again, this is my 12th year. As of October 2025, I've been a pharmacist for 12 years. So every year, I've given my time and attention to new information surrounding disease states, medication innovations, and um, just new information, updated information. And I'm glad to be a part of what is being shared here recently, as a few days ago on TMZ Live. So just to give some more information, they did have a doctor on TMZ to give more detailed information. I just wanted to reiterate some of the information that I learned from the pharmacist's perspective. Okay, so there are preventative medications, such as repellents, insect repellents, so forth. And then there's also treatments such as the epinephrine, diphenhydramine, also known as Benadryl, also Allegra or fexofenadine. There can be Claritin or Loratadine, Zyrtec or cetirizine. There are also a lot of treatments that are over the counter, and then there's some treatments like montelukast, for uh, treatment of allergies in pediatric patients. So, what causes this disease is what they're telling us. Research, the latest research is that a tick, the Lone Star tick, which is found on the eastern coast of the United States, once that tick, which is female described as a little small, dot on the back of the tick, which is the predominant cause of the saliva that carries this molecule. It's a molecule, like a super molecule is what they call it. This super molecule, once it enters into the saliva of the tick bites the human, and then the human is now um, infected, in quote, with a antigen that causes a immunization or immune response with IgE, and antiglobulin, a protein that is made in response to this antigen. And because our bodies respond this way, it's a protective way, but once this antigen produces this immune response, it is later triggered by ingestion of pork, beef, um, lamb, goat meat that we so love. So, I mean, and that response can be a delayed response, which means that it doesn't always, I guess, sequentially happen rapidly. It can be a delay response, as in days to weeks later, where the human that has been infected with this antigen is now developing hives, closure of the throat, enlarged hives, itchy skin, allergic reaction, pretty much. Um, so I guess, we just have to take care. In these days and times, research does not happen as fast as a disease state can occur, as we all know. Looking back on COVID, when COVID was just flourishing, 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 we did not know what was going on. We did not know the source. We did not know if the source was, mutating, or if the source was just, rapidly, growing, or what have you. So the innovation of research takes time, and so we were, good enough and glad enough that Pfizer and AstraZeneca were able to produce vaccinations against the COVID virus. Now, in this particular state, there's no vaccination against this AGS, or alpha gal syndrome, as we know. Um, if there possibly could be a vaccination, you know, that could be in the works. But as of today, there's no cure or, vaccine to prevent. So, as pharmacists, the only thing we can recommend is to treat the symptoms with the epinephrine pen for very serious allergic reaction, or with diphenhydramine, Benadryl, like I mentioned earlier, for those patients who might be experiencing minor symptoms of allergic reaction. Okay, so, and again, all byproducts, whether it be meat products or processed meats, or it could be glycerin capsules, or it could be um, anything related to the ingestion of byproduct of a mammal. So be on the lookout for new innovations, new research, whether it be vaccinations, a cure. So it was something that stuck with me, but I've never been bit by a tick, or being surrounded in an environment where I would be at risk for being you know attacked by a tick bite. So again, um, that's that's just most of the information that I could share with you as a pharmacist. And most of my information that I received in this video is from the pharmacist letter. Pharmacist letter, which gives more information to pharmacy technicians, and also pharmacists, who are like myself, and who have been practicing in community pharmacy for quite some time. So I hope this information has helped you, and please like, share, and subscribe. This is Dr. Erica signing off. Take care. Bye-bye.